Ladies and gentlemen, please welcome to our stage our Chief Operating Officer, John Mercer.
Good afternoon. What an absolutely beautiful, exciting day. I am John Mercer, and I am the Chief Operating Officer at UNC Health Blue Ridge, and I'd like to welcome each and every one of you all to our ribbon cutting for our new patient tower. We broke ground for this 220,000 square foot addition in June of 2022, and I am thrilled to see it completed on time, and it is a testament to our team's dedication and efficiency. I'm so proud that our new patient tower has finally caught up with the exceptional care that we've been giving here at UNC Health Blue Ridge for years and years. At one point in construction, we had more than 200 people on site working on this building. Keeping up with all these workers and projects was the work of our design, engineering, and construction team, led by our very own Deanne Avery, who has done an excellent job. As Director of Capital Projects, Planning, Design, and Construction, Deanne was recognized by Healthcare Design Magazine as one of 10 professionals making a significant impact on healthcare design. We are deeply grateful for your hard work and dedication, Deanne, and this award is a testament to your excellence. Today's celebration will feature some brief remarks, followed by the official ribbon cutting ceremony. We will then invite you all inside of this beautiful tower for a guided tour and refreshments. Now please join me in welcoming our President and CEO, Ms. Kathy Bailey, who is also celebrating her birthday today. She'll share a few words with us. Thank you.
Thank you, John. As many of you know, this ribbon cutting will be my last official duty for Blue Ridge, as I am retiring at the end of this month. But I couldn't be prouder of this accomplishment, and it is the best and biggest birthday present a CEO could ever have. This tower is the largest single addition to this hospital since its construction in 1973. This will house our new emergency department, our new intensive care unit. And one exciting feature is the rooftop helipad, which will facilitate a much easier transport for our critically ill and our trauma patients. It will save time in those most important moments, life-threatening moments. But this is not just a building. It's our commitment, along with UNC Health, to the future of you, to the future of Burke County, and to the future of Western North Carolina. I'd like to say a special thank you to all of our city, county, and state officials who are here with us today. If you're representing city or county or state, please stand so that we can thank you for your support to expanding the healthcare services in this community. Thank you again. We could not have completed this project without your partnerships. We appreciate your support and your dedication to helping us provide excellent health care for the people of our community. At this time, I'd like to turn it over to our board chair, Mr. Mac McCrary.
Thank you. I've come to the point in life where I really appreciate a nice handrail. And this is entirely off the record, but let's do it anyway, just for Kathy Bailey. Happy birthday to you. Happy birthday. Happy birthday, dear Kathy. Happy birthday to you. thank you all for joining us today for this very special occasion. I had the pleasure years and years ago of being in the boardroom when this project was just a gleam in Kathy Bailey's eye. And I will tell you on behalf of all the people who have served on the board through those years that we are extremely pleased to see this project come to fruition and to be ready to offer services to our patients. Our ICU was last updated in 1983. That's a long time to go without a renovation. It was time for it. I think that families will be more comfortable and more welcome in this new facility than they were in our current facility. And for those of you who are going on the tour later, you will see that the rooms are spacious. They are open to outdoor lighting. You have views of the mountains. It's just going to be a much more comfortable place for our patients to begin their healing. You will notice if you go through the tour that several times you'll see features that were suggested by the staff, the doctors and nurses that have to deal with the facility. And they don't mention that enough. The staff had enormous input into the planning of what you'll see when you go through this facility. So we are delighted to be able to offer this facility to improve our service to our patients. One thing that you will not see, I don't think, as you go through the tour, is that there are a couple of floors that are just shell rooms. There's nothing in them at this point. And if you think that Project Forward and the Cancer Center and this patient tower are exciting news, wait till you see what goes in those shell rooms. I can't tell you about that now because I don't know about it now. It is under discussion with our partners at UNC, but I can tell you from the preliminary conversations that it's going to be really, really exciting. So, thank you for joining us today and celebrating this event. It really means a lot for all you folks to have come out. And now I'd like to call on the president of our medical staff, Dr. Rahul Sampath, for his comments.
Thank you, Mr. McQuarrie, for that fantastic speech, as usual. So this tower is a powerful testimony to the vision of so many people. It will almost double the size of our hospital and serve as a reminder that your community hospital is strong. And we will always be there to care for your loved ones, and the real strength of this hospital is in the community that it supports and that supports it. So we appreciate all of you all being here today to celebrate this with us. And we have a special guest today. We're honored to have him in North Carolina to celebrate this momentous occasion. Dr. Rahul Gupta is the first physician to serve as the Director of the National Drug Control Policy and lead the Office of National Drug Control Policy, the ONDCP, which is a component of the Executive Office of the President. So the ONDCP coordinates the nation's $44 billion drug budget and federal policies, including prevention, harm reduction, treatment, recovery, support, and supply reduction across 19 federal agencies, including the Department of Health and Human Services, Justice, defense and education. So in his role, Dr. Gupta serves as the senior-most drug policy advisor to President Biden. So Dr. Gupta has been practicing as a primary care physician for more than 25 years, and he has served in private practice and public health in towns as small as 1,800 residents to cities as large as 25 million. He opened his first medical practice in a small town of Florala, Alabama, and has served as a local public health official and as the West Virginia Health Commissioner under 2 governors, where he brought together public health, law enforcement, healthcare, faith-based leaders, and business partners to solve public health challenges in novel ways. His lifelong commitment to educating the next generation of physicians and policymakers has led him to serve as a clinical professor in the Department of Medicine at Georgetown University School of Medicine and as a visiting faculty at the Harvard University T.H. Chan School of Public Health. Through his work as a physician, researcher, state and local leader, educator, and senior leader of national nonprofit organizations, Dr. Gupta has dedicated his career to improving public health and safety. Let's give a round of applause as we welcome Dr. Gupta.
Good afternoon, everybody. All right. What a fine day today. The weather has been, I want to say I brought the weather with us from DC. Can't take credit for that. And I want to thank my, what I call, same name brother here. If you haven't noticed, we have the same first name. No, seriously, thank you. Thank you, Dr. Sampath. Thank you to Mayor Thompson. For Kathy Bailey, I would say that there are few in across the world, especially in this country and in this state, that can leave a legacy like this. So congratulations to you, your work. I do also want to thank the members of County Commission, City Council, as well as Hugh Blackwell and Donnie Lambert. It is really an honor to be here for me to come back to Burke County. I was here earlier in the year. We got to see the wonderful building being built in progress. And when I was offered the opportunity to come back, I could not say no. So, but let me just first start by giving a round of applause to these folks here, a lot of the hospital staff, and those who've been just amazing and excellent. So thank you. Now, as Dr. Sampath mentioned, I know what it's like to provide care across rural America. I started my first practice in a single wide trailer on Highway 331. I was really happy when it turned into a double wide, because that meant my practice was expanding, and I was everything to my patients. We had a small hospital, and people often paid me in homegrown tomatoes and fresh baked homemade apple pie. That was the way I grew up, I raised my family, and when I was in West Virginia, same thing. Really enjoyed the love and the trust and the faith in the community. And having this facility here to get the care that people need and deserve is such an important piece of this puzzle. You are fortunate to be in an area, in a state that is growing, and that's a blessing. But healthcare is one of the most important needs of a community that is growing. When I walked the last time and today through and saw the trauma rooms, the emergency rooms, the size, the facility, I saw the ability for not only to take care of patients, but also their loved ones at the ICU, the large size with additional bedding. It just impresses me, because you now as a community have the most world-class care right here with the best facility that one can ask for. Now, nobody asks to be here in the hospital, I know that. Nobody wants to be transported in one of the fine helicopters that we saw up there, which you're gonna see. But the fact is that you can rest comfort in that this is as best as they come in terms of a facility. Look, my day job is often dealing with the opioid crisis, something that's killing an American every 5 minutes around the clock. And we're working hard both to expand treatment, which is going to be great right here because you're going to see people who are going to be treated humanely, kindly, and there's enough room and space for them in a separate unit, which impresses a lot from me. But also going after the drug trafficking, including securing our southwest border. So those just balloons, I'm told. I know we've had an event recently, still balloons. So, look, the bottom line is this. There's a lot of work to do when it comes to helping people with their mental health, with their addiction, with their trauma. You right here with the facility that you have and it's going to open, you're going to be at the forefront of fighting the fight, the good fight that we need to save more Americans, to support people with compassion and empathy, and get them the help, because I deeply believe that every life is precious and it's worth saving. And so I'm glad to be back here at UNC Blue Ridge in Morganton. I'm really appreciative of both my colleague, your public health director, Danny Scalise, as well as so many leaders here that I've met and befriended. Thank you for welcoming me and my team back into your community. Thank you so much, and congratulations.
Thank you, Dr. Gupta. We are honored that you are here today to celebrate this momentous occasion with us. And again, a special thanks from me, from our graduate medical education office as well, for you spending time with our medical residents and our Campbell medical students today with the topic and discussion that you had. It was fantastic and just a great opportunity to enhance their learning. So thank you for your willingness to do that for us this morning as well. I'm Anthony Frank. I'm the Chief Medical Officer for UNC Health Blue Ridge. I could not be more excited to extend an invitation to all of you to view this enhancement in healthcare. I'm an emergency physician by training, and so looking at this fantastic new space, I am just really excited for all of our emergency physicians and our ability to enhance the care that we're going to be able to do in this facility with our patients. When you arrived, you should have received a ticket as you entered the ceremony. The ticket has a number on it. It is for your group assignment for a tour. And after the ribbon cutting ceremony, please line up behind our tour guides over here, and they will start your tour and lead you through our new space. At this point, I'll now turn the ceremony over to the president of our Burke Chamber, Ms. Tanya Stevenson, for the official ribbon cutting portion of the ceremony. Thank you.
Hello, everyone. Thank you, Dr. Frank, for your introduction. What a great day for Burke County and our healthcare system. Since moving here, I have been so impressed with this healthcare system, and with the new tower, it's been elevated to a new level. Working at the Chamber of Commerce, one of the greatest moments we get to celebrate with our members is during ribbon cuttings, and today we get to celebrate an expanding business here at UNC Health Blue Ridge. To say a few words for this momentous occasion, I'd like to recognize the Honorable Ronnie Thompson, the Mayor of Morganton.
Thank you, Tanya. I was fortunate enough to get a tour of the hospital, and all I can say is it's unbelievable once you get inside. It's an astonishing place for patients to receive care. My hat is off to everyone who helped design and implement this tower. John and Kathy, it's just a great job that you've done. The city of Morganton is fortunate to have such a progressive hospital system in its midst. We welcome our partnership with Blue Ridge and hope the best for you in the future. I would like to point out that one of our former employees with the city of Morganton spent hours, days, weeks, and months over here, and that's Mike Krotz. If he's in the audience, I want to say thank you so much for making it all happen. He was over here tirelessly. Again, I want to thank Kathy, John, the staff, nurses, all the people involved. We are so happy to have this open and look forward to great patient care. Thank you.
Thank you, Mayor Thompson. Now I'd like to recognize our Burke County Commissioner Chairman, Mr. Jeff Britton.
Thank you, Tanya. Wow, what a great day for UNC Health Blue Ridge, and Kathy and all of your team. Tremendous, tremendous job. And Mr. McQuarrie, our church is looking for a music director. You've already passed the audition, sir. No, in all seriousness, what a great day. Awesome. If you haven't been inside the building, you're going to be just simply blown away. Everything about this facility, state of the art, a beautiful space, spacious. I hope you never have to come, but if you do, you're going to be a lot more comfortable than you've ever been here at this hospital in Morganton. A tremendous asset for the citizens of Burke County, a tremendous asset for the western region of North Carolina. They're just continuing to expand their operation, their abilities, looking forward to trauma center in the near future. Just can't say enough about what's happening here at Blue Ridge. So with that, again, congratulations. And I want, before I step down, if you're a UNC Health Blue Ridge employee, I want you to hold your hand up for just a moment. Everybody look around. The most beautiful, awesome, spacious building in the world don't do what these guys do for us every day, 365 days a year, 24/7. When you have a problem in the middle of the night, whenever that is, this building can't take care of us. It's all these folks that held up their hand. And I wanted to take just a moment to say thank you to all these guys who are tremendous for our community every day here in Burke County in western North Carolina. Thank you very much.
Thank you, Jeff. So Kathy, Mike, John, the whole crew here at UNC Health Blue Ridge, I'm so glad that Jeff recognized them. I would like to congratulate you on behalf of the business community throughout Burke County for what a great accomplishment. I've been very fortunate to tour the tower on several occasions through the progression. Each time I learned about little more about the little touches that they have put into this facility that has just amazed me. Although none of us ever want to have to be in the hospital, if we do, this tower has so many amenities to make our stay more comfortable. And I truly appreciate those details and know that it will well serve our community for the ages to come. So in a tradition of the ribbon cuttings, I'd like to invite our chairman of our ambassadors, Ms. Kelly Messenheimer, to present Ms. Kathy Bailey with a certificate to help remember this day.
Miss Kathy Bailey, on behalf of the Burke County Chamber Ambassadors, I would like to present this certificate to you to commemorate this special day. We are grateful for Blue Ridge, UNC Healthcare Blue Ridge, for all you do for our community, our chamber, and our citizens. You are truly the epitome of friends and neighbors, taking care of friends and neighbors. And we, all from the chamber, thank you and congratulate you.
Now for the big moment, we would like to welcome the Board of Directors of UNC Health Blue Ridge, the senior leadership team, the nursing leadership, the Chamber's Board of Directors as well as ambassadors, other city dignitaries and county dignitaries to join us for pictures over here at the ribbon to officially cut the ribbon. After we cut the ribbon though, please join the hospital and we'll be providing tours for the amazing facility. I also like to say happy birthday to my friend Kathy. We couldn't let this day go by without some birthday cake, so come join us for that. So stay, enjoy some refreshments, and celebrate. And we appreciate you all being here today. Please take some pictures, find your number, and go on a tour. Thank you all. Have a wonderful evening.